My name is Roger Baer.
I'm a consultant eye surgeon working at Sulis Hospital Bath.
And I qualified as a doctor in 1984 and then specialised in ophthalmology, training at Moorfields Eye Hospital in London, and was appointed as a consultant in Bath in 1996. I have over 30 years experience in specialty. My main areas of expertise are cataract surgery and glaucoma. With regards to my cataract practice, I have over 30 years experience of operating. I've performed over 20,000 cataract operations in that time. I have a great deal of experience with the premium lenses, including toric lenses for correcting astigmatism, and some of the newer multifocal lenses which enable some degree of spectacle independence so that you're able to see distance and read clearly at the same time. My main area of clinical practice is glaucoma, which is a condition where the pressure in the eye is too high for that individual. It starts to cause loss of the peripheral visual field and eventually tunnel vision. It's quite common, affecting over 4% of the population over the age of 80 and 2% of the population over 65. Treatment generally starts with drops. Lasers can be used as well, and there is some new research suggesting that lasers may be a good primary alternative to drops. But ultimately, if the pressure remains too high and the visual field continues to deteriorate, then surgery is required.
My private practice is based exclusively at Sulis Hospital Bath.
I've worked here for the last 10 years since it opened. It is a superb facility, very well equipped, extremely friendly and helpful staff. There is a very can-do attitude here. I get things done that need to be done. The theatre runs very smoothly. It's an absolute pleasure to work here. And it's a great environment in which to see and treat my patients. From the moment you arrive, it's a relaxed atmosphere. A lot of patients comment that it has the feel of a hotel rather than a hospital. And there's a very good cafe as well, so that's always a bonus. The facilities are excellent. We have top-rate equipment, and I can basically do what I want to do for that patient. I have access to all the different sorts of lens implants, multifocals, torics, whatever I really need to individualize the maximum visual potential for that patient. The vast majority of my operations are done under local anesthetic. Some patients are particularly frightened or anxious about having eye surgery whilst awake. Normally I can alleviate these anxieties, but if people really want a general anesthetic, that is available, can be done. But usually you'll be done under local anesthetic. You arrive in the hospital, one of the nurses will put a little pellet into the eye to dilate your pupil. You then come to the operating theatre. I will anaesthetize your eye. It's not as scary as it sounds. There are no needles involved or anything like that. It is generally a painless procedure. The eye is frozen, so there's no discomfort. By and large, there's very little vision, so you don't have anybody approaching you with sharp, scary instruments. And there'll be one of the nurses holding your hand, so you have some human contact throughout. The procedure itself is usually achieved in a space of about 10 minutes. Once you return to the ward, there are a few final checks, and then you can be on your way. Recovery is generally quick, normally operating on Wednesday. Certainly by Friday, patients should have excellent vision and the eye should be quite comfortable. I normally see my patients about 2 weeks after the surgery for a final check, and at that point they're either listed to have their second eye done or discharged back to the care of their optometrist. I would say that about a third of my patients have a significant degree of astigmatism. This is something where the cornea, which is the clear window at the front of your eye, is shaped rather more like a rugby ball than a football. So the cornea will bend the light in such a way that it cannot focus at a single point. For the last 10 years, we've been able to correct this with a toric implant. So the cornea will divert the light one way, and the toric lens very cleverly diverts it back the other way, so you end up with sharp focus. These lenses are really excellent. So patients in the past who would have still required glasses for distance correction after cataract surgery generally have excellent levels of vision without any glasses at all. They may still need reading correction. Multifocal lenses are gaining increasingly in popularity. They enable patients to see distance, intermediate and near with remarkable levels of clarity. So a large number of patients will be spectacle independent. There are certain situations where you may still need glasses, such as reading in bed at night, but by and large you can usually get a fair degree of spectacle independence, which is obviously very popular. So if you would like any further information, then contact me on rogerbaer.co.uk. My PA Tash will organise an appointment, and I'll see what I can do to help improve your vision.